Hello, all. Good morning, good afternoon, good evening, whatever the case may be at your end. I'm really glad to share that we are starting our podcast channel at Indian Institute of Public Health, Gandhinagar. And of course, as it is a public health university, we will be calling different people from public health background, like public health students, public health professionals, public health experts. And I can bet you, if you listen to these podcast interviews, there will be something for everyone to get out of it. So just we will start first interview today with Dishani Gupta. He is our first year Masters of Public Health student. Well, I will just start informally with you. Like you are the first ever guest on our show. So hypothetically, you are cutting a ribbon for our program. How do you feel right now?
Hello everyone. I would like to thank Hussain sir for giving me this opportunity for the first ever podcast at IIPHG. Let me introduce myself. I'm Dishani Gupta and I'm from Jaipur, Rajasthan. I'm currently pursuing my Masters in Public Health at Indian Institute of Public Health, Gandhinagar. My background is I'm a physiotherapist and I add years to people's life in illness, injury and disability.
Well, that's really great. It is really nice to hear that. You are the first guest on our show. So, how do you feel about it today?
It's a really ecstatic feeling to be the first person who's giving the podcast.
Great. So, if I can start like this, you have chosen to do masters in public health. So, what were the idea behind this thought? Why you choose this field?
While working as a physiotherapist in my last year, I realized that there were many patients who couldn't afford daily sessions and therefore missed out on the treatment. Some of them could not afford to lose a day at work, while others didn't get proper medical attention when they opted for government hospitals. They continued to suffer as a result, and that was just plain painful for me. This is when I decided that fundamental causes need to be addressed, which was the reason of me joining public health.
That's a great thought behind joining this program because what I perceived is like you are trying to help community.
Exactly.
So that is the reason you have chosen this field.
Exactly.
That's really great, Tishani. So can you just let me know, like you have done bachelor's, right, in physiotherapy. So like how you feel about choosing this field of post-graduation? Like who inspired you to do masters? Like it was your self motivation or someone from your family inspired you to do this course?
I got to know about public health profession during the COVID-19 pandemic, where I saw that how need of competent public health professionals is required in the country. So after working for about 1.5 years in a clinic as a physiotherapist, I decided to switch to public health. Obviously, it wasn't easy to convince my parents for this field because they are understandably concerned for my career. But it took me some time to explain them that what I'm going to do after completing of this degree, how am I going to able to help the community which is more vulnerable, which requires more attention instead of only individual treatments. So that was my thought behind joining this course. And I would like to also add on that the future public health aspirants needs to be passionate about making a difference in the life of others and to have a strong understandings of social determinants in the society. And public health is a diverse rewarding field. You can work in different fields. You can work with immunization, you can work with CSRs, you can work with any kind of approach, and it also includes non-profit organizations. Research options are ample for us.
Great, Dishani. I think you have much deeper knowledge about the field of public health. I will just go out of the list and I'll just ask you, like, as you said right now, that it was really difficult to convince your parents. So, what were the thought behind choosing this public health as a career for your parents? What were your parents thinking?
First of all, like it's very clear that my parents' generation doesn't know what is a public health as a profession. They only know what are doctors, what are nurses, what are paramedical staff. For them, it was completely new, and to my family also, it is a completely new profession. But since we have the option to research more, to get to know, to explore more, so I could able to get this option of pursuing masters in public health. It took a really hard, it took really so many efforts for me to convince them that okay, I gave them examples during COVID-19. I gave them examples of polio also, how surveys are done, how data analysis is done, how are we going to distribute this thing to them. So that's how I was able to convince. Still they are not that much convinced.
Great. So you are still working hard to convince your parents, though you have started the course.
Obviously, it's every day a battle to convince them.
Okay. Well, we wish that you can completely convince your parents very soon.
I'm looking forward to it, sir.
Okay, great. So you said that I also completely agree that there are plethora of subfields itself in public health. There is nutrition, there is national health programs. Even you talked about CSR, that is corporate social responsibility, where you can work. So you already have lots of knowledge in just you are still in first year. So that's really great, and that will really inspire many people to take public health as a career. Now, I'll just like to inquire that as you said, you have done BPT, right? Physiotherapy. So, what kind of things that you have learned in your bachelor's that you can easily apply here in the concepts of masters?
So far, only in treating my batchmates' neck pain and back pains.
Okay.
Obviously, you can consider this back pain as a result of lifestyle in our generation. Long hours of sitting and peering over a smartphone for the long hours with no exercise or little exercises. Also, I would like to add that this issue will be a public health concern in upcoming 2 decades because of the lifestyle, the professions we have now.
Well, yes, this is a big challenge, as you said about this ergonomics kind of situation. I also even face in my day-to-day life as I sit for around 7 hours, sometimes for more than 2 hours continuously. I'm working on a desktop and laptop, so it is really a challenging thing. That's really great that at least you are providing benefits of your bachelor's to your classmates. So that's really great. Now, as you are in this university from last how many months?
That's 3 months.
3 months. So 3 months, like I would just like to ask you, like, how do you feel about this university? Like, from your heart, what is the feeling about this campus? What are the things that you really like about this university? It may be friends, it may be class, it may be the garden. What are the things that you really like?
So, my experience at IIPG in the last 3 months has been truly enriching and transformative so far. The university fosters a vibrant and intellectually stimulating environment that nurtures a passion for public health. The faculty is truly dedicated to teaching and mentoring students, providing us with each and every tool and guidance we need to become a competent public health professionals. I would like to add also that students from diverse professions have joined me here, and learning with them, sharing their ideas, working on projects together teaches us a teamwork which have a collective goal. This collaborative spirit extends beyond the classroom as students engage in various extracurricular activities on different occasions. So I would like to share an incident which is a very eye-opening for me. We had the opportunity to go for a transit walk in a nearby rural area during one of our modules of SBSH, where Dr. Bharti gave us this opportunity, where we saw the living conditions of villagers closely. It made me realize how different the ground reality can be from what we see in media or read in books. It made me really, made me appreciate the practical learning culture here at IIPH.
Okay, so you have already been in the field.
Yes.
Okay, so do you like field work?
I really appreciated that I got to connect with lots and lots of people. We got to know how privileges exist with me, how privileges are different for me and for them. So it's really an eye-opening situation.
Great. So, like, if I ask you, like, in future, once you become a public health professional, if once you pass your master's degree, you will go for a desk kind of research, like sitting and doing a research on a secondary data, or you would like to go in the field, meet people, ask questions, learn more about people. What kind of public health career you would like to choose once you complete this career?
I would like to engage with people more because while engaging with them, it tells us their experiences, what they need, what they require, how are they living. So I can compare what they really require and what should be a mandatory thing, at least a bare minimum thing to live in the world.
Okay, that's great. So you already shared with us in the beginning that you would like to work for community, and now you are saying that you want to be with people, talk to people, learn more about people from various diverse backgrounds and diverse communities. So we see a dedicated and committed public health professional who will definitely work for the community.
Yes, sir. Definitely.
That sounds really interesting. So I will just go out of the box and I'll just ask you once again. Like, as you are saying that you will work for community and you will meet different people. So if after completing the degree, what will be more important for you? Money, salary, or working for the community? Because just give as realistic answer as possible, and so that we can also get an idea that what public health student like you in the first year thinks.
I would like to say I would work more for community because previously when I was working with the trust, I got the chances to interact with less privileged people, and when hearing them out, it tells us that how important it is for bare minimum and not to work for the money, because serving people will eventually give you a satisfaction that no amount of money can give you. So I stay with this motto of mine that work for community, money will come out.
That's something a unique response. And well, Dishani, just don't think that this is a job interview. You are just discussing the things, you are expressing your story to us. That last line that you said was really meaningful line, that if you work for community wholeheartedly, then money will definitely come. That's what we have also observed in this university and also in the community. Like, if you work dedicatedly for something, then money will definitely come with your work.
Money will definitely come. Money is going nowhere. But satisfaction is something that you should crave for every day, every night. When you go to sleep, you should realize that, okay, I have done something good. And you should not sleep with a feeling, no, I need to do something, it's only money that I'm getting right now. So I would love to sleep with the satisfaction, and I crave for satisfaction.
Okay, now as we discussed before that there are plethora of subfields in public health, be it nutrition or national health programs or many things, NCDs, communicable diseases, epidemiology, biostatistics. There are many things, like I cannot even count on my fingers. It is very deep. Public health is very, very deep. So what is the one subject where you would like to do specialization? Because of course you are in first year. As far as I know, you will be going in internship for 3 months in first year. You may be knowing that, right?
Yes, sir. We'll be going for an internship in our next semester.
Great. And you will also be going for 6 months dissertation in the second year. So by now, as you have already spent 3 months in this university, by now have you decided what kind of specialization you would like to go with?
Right now we are learning about different aspects of public health. To commit something that, okay, I'll stick to this is hard because there is a lot to explore yet. We have a number of subjects in the second semester also, which will grow our interest in different subjects. So it's really hard to commit as of now. but I would say I would more work towards occupational hazards that comes in with my background also, and especially in ergonomics.
That was an honest answer, to be very frank, that you have directly said that it is really tough to decide at this point of time. And of course, yes, you have done BPT, and that's how you have preliminary thought that you will go with occupational health and hazards. So that's really great. And yes, you also rightly mentioned, and just before 3-4 minutes back, that I also agree with you really that there are established careers if you see across the world. Just forget the world, across India, you will see that there are chartered accountants, CA, this is an established field. There is CS, company secretary, established field, lawyers, established field. Still, we are struggling somewhere to say proudly that we are public health professionals. So, you also mentioned very correctly, right? Like we are still establishing. So, what are your thoughts about it? Like, what one can do to really recognize himself or herself as a public health professional and altogether the field as well?
I would say don't compare yourselves to the other professions, because what your profession offers is very different to what a doctor, a nurse, or anyone would offer. They offer an one-on-one service, but you offer it to community. So you make a change in the community, and that is very much rewarding, I would say.
Okay. Now, we have already talked about that. What is your short-term plans and all after masters in public health? And what I have summarized is you would like to work for community, and if you will work wholeheartedly, the money will automatically come. But what is your vision for next 10 years? Like where you are looking yourself after 10 years or maybe after a decade? If you don't mind, can I ask how old are you at the moment?
I'm 25.
25, okay. So once you cross 35, what are your plans in the context of career I am asking?
I would say I had great aspirations for myself. I wanted to bring about the change in the world that Gandhiji mentioned, that smallest of the change matters. However, 3 months into the course, and I knew the smallest of change mattered. We learned that how our country moved from culture of home deliveries to more than 98% of institutional deliveries. How our country moved from maximum number of polio cases in the world to eliminating polio. How our country is working to minimize anemia among women of our country. The point I'm trying to make here is I realize the change, however small, matters. Aspirations only work as far as we do. So my only aspiration for myself right now is to contribute to public health as much as I can and bring about the change in the lives of those who need it the most.
Okay, so let me put it in this way. Do you have any role model, not a celebrity, but any role model which you think like you are continuously following him or her in public health field? If you ask me, then I can say that health minister. I continuously look what he is doing, what he is thinking about the health of community, the health of city or state, or else I'll think about a professor of my university who is teaching brilliantly. So you would like to be a researcher in public health, again, like a desk researcher or action researcher, like going in the field and collecting data and then analyzing the data and doing research, or you would like to be a academician will of course do research, or you would like to work for NGOs, or you would like to, as you rightly mentioned, CSR, you would like to work for any corporate organizations. So that's how I put it. Where do you see yourself? Or you are thinking to do investments and open your own establishments after 10 years. So you want to do job, or you want to do a kind of setup, I will not say business, but as a kind of some establishments of public health. What is your vision? What kind of thing you are thinking after 10 years?
Oh, I would say that was a bombardment of questions for me.
Okay.
But to me, right till now, I have seen my professors, but I would really appreciate the hard work of my mentor, Mr. Mahavir Golecha sir, who works endlessly to complete what he has committed. He has been working on different projects, he has published papers, and he tells me that how this will help you in future, how this particular field will help you to grow more. So I would say he would be my role model for he's a role model in the university, and I would really work as an action researcher who goes to the field, who interviews people, who get to know about them, and then put it in my data and analyze that, because when you know the data from the ground, you can analyze it better rather than just getting the data and analyzing.
It was really interesting talking to you, and I also learnt a lot from this conversation. Lastly, if you'd like to add something, if you would like to share something apart from what we have already discussed till now.
I, at last, I would like to end this with IIPG is a great platform for public health. It gives you ample number of opportunities to grow and to work with.
Thanks, Dishani, and I think that this conversation will really help people to clear their ideas, their doubts as well. Thank you so much. Good luck.
Thank you for having me, sir. Thank you for giving me this opportunity. Thank you.
Thanks. Thank you.